So now we are going to discuss the INI CET forensic paper. Myself, Dr. Akhilesh Raj Jamad, your Marrow forensic faculty. If you see the pattern of questions, the questions were simple, direct questions. And almost all questions were directly from notes. So it's a very simple pattern, but we have to see the options and we have to see the variety of questions, because in INI CET questions, the questions are repeated over and over again and the topics are repeated. So we have to concentrate on the topics which are frequently being asked. So let's see. The first question. In postmortem examination of a patient reveals the following. The picture is given here. And you have to identify the type of injury. The four options are given: hesitation cut, grazed abrasion, laceration, pattern bruise. The last two options are ruled out easily. Everyone knows laceration is by heavy blunt force. So it's an injury of epidermis, dermis, or subcutaneous tissue. It's leading splitting of the surface, epidermis, dermis, and subcutaneous tissue. This is laceration. Now, pattern bruise, the bruise which is forming the pattern. Example of the pattern bruise are six-penny bruise. Six-penny bruise are the coin-shaped bruise seen in throttling as well as battered baby syndrome. If you see, the coin-shaped bruise are caused by fingertip pressure. Fingertip pressure. And even if you see, the one more important type of the pattern bruise is a butterfly bruise. Butterfly bruise, friends, butterfly bruise is also seen in battered baby syndrome. So battered baby syndrome causing pinching of the baby, that will produce the butterfly bruise. So laceration and pattern bruise are ruled out. Now the only option left are hesitational cut or grazed abrasion. Now see, the grazed abrasion is by grazing on the surface, and I would use a word, it's a sliding abrasion. If you slide on the surface, it's a grazed abrasion, and there will be, we'll see the accumulation of lines that is seen in grazed abrasion. Grazed abrasion is also known as brush burn. It is also known as brush burn. And it is the most common abrasion in the road traffic accident. Most common abrasion in the road traffic accident. So if you see these abrasion, which is giving burning sensation and look like a brush, this is grazed abrasion. So this option is also ruled out. Why? If you see this injury again, these are the cut. These are the cut, and you can see the blood accumulating surrounding the cut. That is blood accumulating surrounding the cut. Multiple cuts over the forearm and wrist. So the common site of these cuts are wrist and forearm. My dear friend, these are self-inflicted injuries. So I'll again come to the very important point, the self-inflicted incised wound. If you are having multiple cuts, multiple lines, multiple superficial lines, multiple superficial lines surrounded by blood. Friends, these are self-inflicted injury, suicidal in nature. Suicidal in nature. And we can give three names to these cut. The number one is hesitational cut. The number one is hesitational because the person is hesitative. The number two is tentative cut. And number three, we can use a word trial cut. So all are suicidal, multiple superficial injuries. Hesitational cut, tentative cuts, or trial cut. So if you see the option here, which is the best suited here, is hesitational cut. You have a cut, linear pattern, superficial cut, and these are suicidal in nature, self-inflicted injury. self-inflicted injury. So this question, the answer is this one. You can easily rule out the grazed abrasion caused by grazing. Yes, simple. Brush burn. Most common abrasion of the road traffic accident. You can easily rule out the laceration by heavy blunt force, splitting of the surface, splitting of epidermis, dermis and subcutaneous tissue, generally having irregular margin. And you can easily rule out the pattern bruise. The answer is hesitational cut. Now, my dear friend, the second questions, and actually I have seen in most of the exam, NEET PG or INI CET exam, the one question is asked about the traces of evidences, blood stain, seminal stain, hair. And this question is about the vaginal cells, how to examine the vaginal cells on a rape victim. And sometimes you can get a question like on the accused penis, how to examine the vaginal cells. Sir, first we'll see the option, then we'll go for other. The first option is given, Florence test. So Florence test is used for seminal stain. Seminal stain. And you can easily remember, it is used to identify choline crystal. Choline crystal. You can see C, it is for C, choline. Choline crystal, and the shape of the crystal is brown rhombic shape. The shape of the crystal is brown rhombic shape. You can remember by a trick, chole. The color of the chole is brown. It's a brown rhombic crystal. It is for seminal stain. The second is toluidine blue, sir. This test is used for blood. Recent injuries, recent micro injuries on the body, which are not visible, the small injury, recent micro injury in the body, we can go for toluidine blood. So toluidine blue test, it is for blood examination, or recent micro injury examination, we go for toluidine test. The third is very important, Lugol iodine, sir. Lugol iodine we use filter, and it gives a color change, brown color change, and this is the test, my dear friend, for your vaginal cells, sir. Even vaginal cells on penis or vaginal cells on victim's body can be examined by this. And if for vaginal cells, if Lugol iodine is not available, we can use one more stain, that is Papanicolo. Papanicolo stain, that can also be used. So the last test is precipitin test. Precipitin test can be used for blood, for hair, and for other evidences. It is for identify the species, human or animal species. We use the precipitin test. So, which is the best test for species identification? The answer would be precipitin test. So here the best answer goes to the Lugol's iodine if you want to examine the vaginal cells. And as I told you, another important stain is Papanicolo stain. Now, Florence test, as I already told you, it is for seminal stain, and Florence stain, we examine choline crystal. Choline crystal. It is forming choline iodide. Iodine is used, choline iodide. That gives brown rhombic crystal formation. The second is Barbeриоз. So Barbeриоз is also for semen, but it is used to detect spermine crystal, and it is forming spermine picrate. Spermine picrate. So it is giving yellow needle shaped crystal. You can remember by a trick, Barber used needle, yellow needle shaped crystal. Now two tests for blood stain. One is Takayama. Takayama forms pink feathery crystal. Takayama forms pink feathery crystal, and these crystals are actually hemochromogen. These crystals are actually hemochromogen crystal. The test is Takayama. Takayama. And the fourth test is Tickman, my dear friend. Tickman is also for blood stain, my dear friend. Takayama and Tickman both are for blood stain. It is forming hemine or hematine crystal, and it is also showing brown rhombic crystal. So, brown rhombic crystal in the blood stain, the answer is Stickman test, and brown rhombic crystal in the seminal stain, the answer is Florence test. Very, very important, sir. So this was a question been asked about the traces of evidence, and I am always expecting one question from this, either blood stain, seminal stain, hair, or blood grouping. For blood grouping, we use the elution technique. Acid elution method, modified acid elution method are used for blood grouping. Now, sir, a very, very important word. What is the treatment of choice for arsenic poisoning? Sir, first see, what are the options given? Ipecac, it is used as a emetics to take the poison out through vomiting. Second, penicillamine. Penicillamine is a chelating agent. It is a chelating agent specially used for copper. The best chelating agent for copper is penicillamine. But remember, sir, the antidote for copper is potassium ferrocyanide. Chemical antidote for copper is potassium ferrocyanide. Activated charcoal, everyone knows, is a black powder. It's a black powder and it absorbs the poison. Activated charcoal absorbs the poison. So activated charcoal is example of physical or mechanical antidote. The word I'm highlighting, it's a physical, not physiological. Physiological means it's opposite in function. It's a physical or mechanical antidote. It absorbs the poison on the surface. But sir, now this was dimercaprol. Actually, friends, dimercaprol is another name of BAL. What is BAL? British. BAL is British anti-leucite. BAL is British anti-leucite, an intramuscular injection, my dear friend. And it is very commonly used for arsenic poisoning. British anti-leucite. If you see, the BAL is contraindicated. The trick is very simple. It is contraindicated CI. So it is contraindicated in CI, C for cadmium, I for iron, and if you want to add one more, that's the organic mercury. It is an intramuscular injection. It is given in many metallic. It's the most commonly used as a chelating agent, BAL, British anti-leucite. So here, without any doubt, we can go for these. The important treatment is for it is dimercaprol, which is also known as BAL. Very, very important. Now, sir, like same kind of question, now the important features of chronic arsenic poisoning has been asked. Chronic, actually, if you go for the acute arsenic poisoning, it causes gastroenteritis. It mimics cholera. But sir, the question is asked about the chronic arsenic poisoning. I'm just telling you, like if the arsenic poisoning is chronic, in acute arsenic poisoning, it is going to the liver and blood. That's a chronic arsenic poisoning. It mainly involves bone, skin, nail, and hair. And if you see, it causes bone marrow depression, simple. In skin, it causes raindrop pigmentation. In skin, it causes raindrop pigmentation. In the nail, it causes Eldritch Mees line. Eldritch Mees line, which are the transverse line on the nail, these are known as Eldritch Mees line. Hair, it also causes discoloration of the hair. So if you see the option and if you want to pick any of these, sir, raindrop pigmentation, yes, right answer. It causes neuropathy also. It causes sensory as well as motor neuropathy. Even if you want to write down, sensory is more common than motor. It causes Mees line also. So first option, second option, and third options are correct. Luminous vomiting, sir. Luminous vomiting is a feature of phosphorus poisoning. White phosphorus. White is a luminous phosphorus. I told you the trick. The red phosphorus, everything is no. Non-toxic, no smell, non-luminous. For white, everything is, yes, toxic, garlicky smell, and it's luminous. White phosphorus is a Diwali poison used for making crackers. So if you see, the best answer, it will be 1, 2, 3. All are correct. All are correct. Luminous vomiting. And few students were saying there is one more option, that's a bone marrow depression. If that is there, you can add because it causes bone marrow depression also. Fatal dose of arsenic, anyone if you want to put, it is almost 100 to 200 milligram fatal dose of arsenic. Arsenic causes, one question came in the recent exam, arsenic causes black foot disease. Black foot disease. So if you see, it causes black foot disease. It also causes hyperkeratosis of palm and sole. There will be hyperpigmentation, hyperthickening of palm and sole. This is also. Sensory motor neuropathy, peripheral ischemia. It causes peripheral ischemia. That's why I used a word black foot disease. This is Eldritch-Meesline. Eldritch-Meesline are also seen in the toxicity which is caused by thallium. But thallium has also some more problem like behavioral changes, like the lateral loss of eyebrows. These are also seen in thallium toxicity. Thallium is an ideal homicidal poison, my dear friend. Thallium is ideal homicidal poison, and arsenic is most commonly used homicidal poison. And many compound of arsenic we have. Arsenic trioxide, arsenic copper arsenite, Chiles green, copper acetoarsenite, Paris green. So many types of compound we have. So this is arsenic poisoning. Treatment, I told you, we can go for this. And arsenic, acute arsenic poisoning, acute, I'm not talking about the this one. Acute, I told you, it causes gastroenteritis. It look like a disease which is cholera. The rice watery type stool. Rice watery type stool, that is, it look like a disease cholera. But the symptoms are, actually I have seen the arsenic is a hot topic. Sometimes it's been asked like the sequence of the symptom, throat pain, vomiting, purging, sometimes how it look like, sometimes the treatment is asked, sometimes the chronic arsenic poisoning symptoms are asked. I have seen in every exam one question you get from arsenic. So here answer is 1, 2, 3. So the next question is poisoning with which of the following agent which would cause hypertension? If you see, the 4 options are given: organophosphate, acute alcoholism, arsenic, cocaine. Organophosphate, everyone knows, like the muscarinic and nicotinic, it never causes hypertension. It causes the muscarinic effect, dumbbells, bradycardia, increase all secretion, constriction of the pupil. Acute alcoholism, it can cause hypotension as well as hyper in the later stages. So it's not the right answer here. Arsenic, as I told you, it causes ischemia. It doesn't cause hypertension. But so this word, cocaine, it causes hypertension. Actually, if you see, cocaine has sympathomimetic toxidrome. So it has all important features which are sympathomimetic, that you can see arrhythmia, hypertension, hyperthermia, mydriasis, and tachycardia. Cocaine is also known as crack, coke, snow, and white lady. The name is white lady, but it causes black tongue and black teeth. And cocaine causes a tactile hallucination, which is also known as Magnan symptom. Cocaine causes a tactile hallucination, which is known as Magnan symptom. Cocaine plus heroin is known as speedball. So this is a sympathomimetic, so it causes hypertension. The best answer is cocaine. The antidote is amyl nitrite for cooking. So again, a very important MCQ about the hypertension. Now, sir, as like I discussed in marrow MCQ classes and rapid revision classes, because this is my most anticipated question, when fingerprints develop in intrauterine life, in fetal life. Sir, it start developing at 12 week to 16 week and completes around 24 weeks. And the best answer, it start developing in 12 to 16 weeks. It is the best method for criminal identification. Fingerprint, it is also known as Galton system. It is the best method for criminal identification, known as a Galton system. Known as a Galton system, what was discovered by William Herschel. William Herschel. Fingerprint Bureau first was established in Kolkata. And you can see, my dear friend, this is the most common variety of fingerprint, loop variety. You can see this triradiate things coming from three direction. It is known as delta, and convergence point, this is known as core. So in loop variety, we have one core plus one delta. In arch variety, no convergence, nothing is coming from three direction. So in arch variety, no core, no delta. In whorl, which is a circular pattern, if you see, this is we are having one core and this is two. One delta, two delta. So one core and two delta, it's a whorl variety, my dear friend. So this is very, very important. And the most common variety is the loop variety. Most common variety is the loop variety. You can remember love, wife, and children. Loop, love, wife, whorl, and arch, children, composite. And the minimum point should be similar. That should be 10 to 12 point criteria. 10 to 12 point criteria. Now, sir, sometimes you can get a question, the atrophy of the fingerprint or ridges. The complete atrophy you can remember by celiac disease, CC. Incomplete atrophy, it is seen in dermatitis, like dermatitis herpetiformis. Permanent alteration of the fingerprint, this is seen in radiation, leprosy, and excessive burn, which is known as charring. Permanent alteration. Alteration of the pattern, some alteration of the pattern, it is seen in scleroderma. So actually, fingerprint is also a very hot topic of the INI CET exam. Fingerprint, arsenic, injury, mechanical injury, these are generally asked in INI CET exam. So this is a very interesting question actually. The Sagar was being tried in the court for the murder of Mohan in the park. Seeker appeared in the court. Means Seeker is a witness and said he saw Sagar carrying a knife in his hand. Means he saw Sagar carrying a knife in the hand. He has not seen the murder. Sagar was being tried for murder of Mohan. It means, sir, Sagar killed Mohan. And if Seeker has seen this murder, Seeker is an example of direct evidence. Direct evidence, or I would say a very simple word, eyewitness. Eyewitness. But Seeker has not seen the murder, had not seen the murder. What Seeker has seen? Seeker has seen when the Sagar came out and Sagar carrying a knife. Seeker has seen Sagar carrying a knife. It means he is not a direct witness or direct evidence. He is an example of indirect evidence. If I see the murder, I am a direct. But if I don't see the murder, but I see like the person is coming out with knife, that's an indirect. Like I see a person who is having blood-stained cloth coming out from the room, that's an indirect. Hostile is no relation with this one, Dr. Saab. Hostile who is changing the statement repetitively, this is a hostile witness, so that is no hostile evidence. Hearsay. What is here? You heard something then saying something. Like Ram told me that Sagar killed Mohan. Ram told me. Now I am a hearsay witness. Because I have not seen the murder. I have not seen the indirect evidence. I am just hearing and saying whatever Ram said to me. So this is a very simple question, sir. Direct evidence is when you see the directly and you are giving evidence. Indirect, you have some evidence, but that is indirect. Like your clothes are bloodstained and you are carrying a knife after coming out from the room after killing. That's indirect evidence. And hostile, who is changing the statement. And hearsay, you heard something, then you are saying something, that is known as hearsay. So, sir, without any doubt, the answer is indirect evidence. Indirect evidence. Indirect evidence is also known as corroborative evidence. It's a corroborative, the supportive evidence. And indirect gives some inference about the crime. This is indirect evidence. Now, sir, the next question. A male was presented with history of consumption of an unknown substance. There was an increase in sweating, lacrimation, diarrhea, and bradycardia. So these all are the symptoms which are muscarinic cholinergic symptom. These all are muscarinic cholinergic symptom. You remember the cholinergic symptom by a trick? Dumbbell, diarrhea, urinary incontinence, meiosis, and everything. Bronchoria, these you remember. But sir, the muscarinic cholinergic symptom you can remember by one more easy trick, BSC. Because this is sufficient, my dear friend. B for bradycardia. S for secretion of the body are increased. And C for constriction of pupil, which is known as meiosis. Now, sir, the question is asked, what is the management? Sir, for these, the management is atropine, anticholinergic, atropine. Yes, peridoxime and obidoxime, these are the oximes. These are the oxime we also give, but the best choice will be atropine. Calcium gluconate is the antidote of choice for hypocalcemia. So you will use a word. In oxalic acid poisoning, you can use calcium gluconate, oxalate poisoning. Oxalic acid is an ink remover. It causes hypocalcemia, so you can use. And also, many times the question comes regarding the antidote. Like atropine is for cholinergic symptom. Obidoxime can also be used for this, it's a cholinergic symptom. Oxalate poisoning, we use calcium gluconate. Even one question regarding like the paracetamol poisoning. We use N-acetylcysteine, a very important antidote. For benzodiazepine, we use flumazenil. That can also be. So many antidote. One question of the antidote always comes in exam. So be careful. This is atropine. Now, sir, this one, very, very important one. Identify the plant and image. Only the question was asked. The plant and image you have to identify. Datura alba, Argemone mexicana, Nerium odorum, or Papaver somniferum. Sir, first, Datura alba is a white Datura. Nerium odorum is white oleander. Nerium odorum is a white oleander, and Papaver somniferum is a poppy fruit. Poppy fruit. I will show you this picture first. This is poppy fruit. By this, we make afim opium, which is also known as kasumba. We are giving vertical incision and we are making afim. And one product of afim is a morphine used in the cancer and as a painkiller. And sir, one variant semi-synthetic product of the morphine is diacetyl morphine. So these are some important products. Sir, this is Datura alba. Yes, Datura alba. This is white Datura. And this is yellow oleander. This is yellow oleander. Friends, the yellow oleander, which is also known as cerebra thivacea. So the active principle are cerebrine or thivacine. And this is white oleander or pink oleander. This is Nerium odorum. The active principle is nerine. So one thing is clear, like out of these options, nothing is here. This is actually a Argemone mexicana. This is known as Argemone mexicana. And Oxab, remember, You can see the yellow flower and with some leaves which are like prickle shaped leaves. This is Argemone mexicana. And friends, Argemone mexicana, let's like the oil of Argemone seed are adulterated with mustard oil. This can cause a very important problem which is known as epidemic dropsy. And Dr. Saab, here the main toxin or active principle which are very dangerous, this is sanguinarine and dihydrosanguinarine. So it is adulterated with mustard oil. It goes in your body, it causes edema by increasing capillary permeability, my dear friend, which will cause the hypotension, and as a compensatory mechanism, there will be congestive cardiac failure, CCF, congestive cardiac failure. There will be breathlessness and many other symptoms. So this is Argemone mexicana. And remember, my dear friend, here the treatment is just symptomatic treatment and remove the poison from your body, remove the toxin from your body. That is the treatment. So the treatment mainly is the symptomatic treatment. Treat the organ failure, treat the congestive cardiac failure. This is Argemone mexicana. So you can get this question also. These are the active principle. What is the treatment and how does it act? By increasing capillary permeability, it causes edema. As a compensatory mechanism, it can cause the congestive cardiac failure. So these are the questions we have discussed, and these are some very, very important MCQs which came in the INI CET exam. And every question, like definitely, directly or indirectly came from the notes, and do it because and the topics are repeated, my dear friend. So please go through all the important topics of the forensic medicine. Good luck. Goodbye.